Okay, so today we will see about one drug from pharmacology, that is dutasteride. So we know there are various drugs which we study basically in pharmacology, and I have started this video to see some details about the dutasteride. So what is this dutasteride, how does it act, and where is it used, we will see. So this is the strip of the dutasteride tablets. So there are on each strip we get all the details of that tablet. So this strip shows that it is a tablet of dutasteride with strength of 0.5 mg, and the brand name of this tablet is well tried. Okay, so each company has its own brand name. जैसे this drug is prepared by the Intas pharmaceutical company, and it has given the name well tried to this tablet of dutasteride. So how does this dutasteride act? What is the mechanism of action? So basically this dutasteride is a drug which acts by inhibiting one enzyme, that is 5-alpha reductase. So it is a 5-alpha reductase inhibitor. So we have to see what is this 5-alpha reductase and how does this act in our body. So this 5-alpha reductase is responsible for the conversion of testosterone into DHT, and this dutasteride, it inhibits 5-alpha reductase, and thus it inhibits the formation of DHT. So we will see one by one what is this testosterone, what is DHT, and what is this dutasteride. So in this diagram you can see the picture of our genitourinary system. So there is a bladder, and there is urethra, and there is the prostate gland, and here the flow of the urine is shown. So testosterone, as we all know, it's a steroid in our body, which is normally present in our body, and other names for this testosterone are, it is a male sex hormone, also known as androgen, and these male sex hormones are responsible for our growth of various organs in our body. Now what is this dihydrotestosterone or DHT? So this DHT is the it is formed from the testosterone by the action of 5-alpha reductase, and this DHT is 10 times more potent than the testosterone in stimulating androgen receptors. So both this testosterone and DHT act by stimulating the androgen receptor. This DHT is responsible for the growth of the prostate, and also it causes the hair follicle miniaturization. So these are the two actions of DHT or the dihydrotestosterone. And so what is BPH or benign prostatic hyperplasia? So in BPH there is overgrowth of the prostate gland, and this prostate gland causes the constriction of the urethra, and this leads to various signs and symptoms in BPH. So the symptoms are there is difficulty in starting to urinate, मतलब पेशेंट को जोड़ लगा के भी पेशाब नहीं आएगा. सेकंड, देर इज वीक स्ट्रीम ऑफ यूरिन, मतलब जो पेशाब है उसका धीरे धीरे आएगा. एंड देर इज ड्रिबलिंग एट द एंड ऑफ यूरिनेशन. एंड अदर सिम्टम्स आर देर इज अर्जेंसी, मतलब देर इज पेशेंट को स्ट्रॉन्ग डिजायर होगा कि यूरिनेट करने का. ठीक है. एंड देर इज फ्रीक्वेंसी ऑल्सो, मतलब पेशेंट को बार बार पेशाब को जाना पड़ेगा. सो ये जो 5-alpha reductase इनहिबिटर है, ये क्या करता है, ये जो सिम्टम्स है BPH के उसको ठीक करता है बाय डिक्रीजिंग द लेवल्स ऑफ डायहाइड्रोटेस्टोस्टेरॉन, क्योंकि यहाँ पे मेन कल्प्रिट जो है दैट इज द डायहाइड्रोटेस्टोस्टेरॉन, जिसकी वजह से इस प्रोस्टेट ग्लैंड का ग्रोथ होता है. So by decreasing the levels, it causes the shrinkage of the prostate gland. It also relieves the urinary obstructive symptoms and it slows the progression of BPH. तो आगे के जो कॉम्प्लिकेशंस है वो नहीं होंगे, और जो ऑब्स्ट्रक्टिव सिम्टम्स देखे हमने, जैसे पेशेंट को जोड़ लगा के भी पेशाब नहीं आता है तो वो भी ठीक हो जाता है. तो इसलिए हम ये ड्यूटास्टेरॉइड टैबलेट यूज करते हैं. नाउ कमिंग टू 5-alpha reductase inhibitor. तो ये जो 5-alpha reductase inhibitor जो है that is the dutasteride. So this dutasteride inhibits both the isoenzymes of this enzyme. So type 1 and type 2. This type 2 isoenzyme is present in the prostate, in seminal vesicles and hair follicles, and type 1 is present in the skin, liver and scalp. ठीक है. So by inhibiting this 5-alpha reductase, it is helpful in the treatment of BPH, that is benign prostate hyperplasia. So हमने देखे इसमें ये कैसे सिम्टम्स को डिक्रीज करता है या ट्रीट करता है. इट डिक्रीजेस द साइज ऑफ द प्रोस्टेट एंड इम्प्रूव्स द obstructive urinary symptoms. There is another drug which is known as finasteride. Finasteride जो है it is less potent as compared to dutasteride. It inhibits only the type 2 5-alpha reductase, whereas this dutasteride it inhibits both the type 1 and type 2 5-alpha reductase. So इसको याद रखने का सबसे आसान तरीका है, जैसे ड्यूटास्टेराइड इसके नाम में लिखा है ड्यू मीन्स 2. So it inhibits both type 1 and type 2 enzymes. Now coming to uses and the adverse effects of dutasteride. So this as we have seen earlier, this dutasteride is useful in the treatment of BPH because it decreases the growth of prostate, or it shrinks the prostate. And secondly, it is also used in the treatment of hair loss. So it slows down the hair loss, but it is off-label use. Now coming to adverse effects, these adverse effects are related to sexual functions, like it decreases the libido, erectile dysfunction is there, it can cause ejaculation disorders, then it can cause depression also, and there is gynecomastia. Gynecomastia means the growth of the breast in males. Now for the so this was all about the dutasteride. Now when we treat this BPH, we commonly give a fixed dose combination of two drugs, that is dutasteride and second is the tamsulosin. And in the market it comes by the name Veltum Plus MR. MR is the modified release tablet. So this Veltum Plus is commonly given in the treatment of benign prostatic hyperplasia. So the strength is 0.5 mg dutasteride and there is 0.4 mg of tamsulosin. So this tamsulosin is alpha 1 selective agonist. So this was all about the treatment of BPH. Now coming to some other drugs which are very confusing or similar in the name. So first is the androgen receptor blockers. So we know that this androgen receptor are responsible for the action of androgen, that is testosterone and dihydrotestosterone. So the drugs that directly block these receptors are the flutamide, bicalutamide, nilutamide and enzalutamide. So all these drugs end in common suffix, that is lutamide. So whenever you see a drug which ends in lutamide, that is the androgen receptor blocker. So how does these androgen receptor blockers act? So these androgen receptor blockers act by blocking the gene transcription in the respective cell. So the testosterone normally binds to the androgen receptor, and it promotes the gene transcription, leading to prostate growth and other male secondary sexual characters. The anti-androgens or the androgen receptor blockers, they block these receptors, and this leads to inhibition of androgen dependent growth, especially in prostate cancer. So these androgen receptor blockers are commonly used in the treatment of prostate cancer. These are not used in the treatment of benign prostatic hyperplasia. Now we will see the various other drugs that are used in the treatment of benign prostatic hyperplasia. So first one is the alpha-1 receptor blockers like tamsulosin, alfuzosin, terazosin, doxazosin and silodosin. Another is 5-alpha reductase inhibitors, which we have seen earlier, that is finasteride and dutasteride. And third is the combination therapy, that is a fixed dose combination of dutasteride and tamsulosin, which comes by the brand name of Veltum Plus. So there are other groups also which can be used in the treatment of benign prostatic hyperplasia. So the another group is PDE5 inhibitors, that is phosphodiesterase 5 inhibitors. So it is a newer drug, and the drug in this group is tadalafil. This tadalafil is given in the dose of 5 mg, and it should be given daily. The other groups that can be used in the treatment of BPH are the muscarinic antagonists like tolterodine, solifenacin and oxybutynin. So these are the anticholinergic drugs. They act by blocking the M3 receptors present on the bladder. And the next is the beta-3 adrenergic agonist. It is the recent one, and the example is mirabegron. So mirabegron is the recent development in the treatment of benign prostatic hyperplasia. Coming to some other drugs which are under evaluation or are used by off-label. So first one is the desmopressin. Desmopressin, it decreases the urine production, and it is helpful in the treatment of nocturia. Nocturia means the patient gets urination at the night time frequently. Then another is the botulinum toxin injections and the phytotherapy. So the evidences are weak, and the guidelines do not recommend use of these drugs. So these are under evaluation only.